Hello, everyone, and welcome to Supporting Our Children During a Global Pandemic, supporting the mental health needs of our youth. My name is Jamie Stormer, and I am the Director of Children's Outpatient Services in Alachua County for Meridian Behavioral Health Care. I wanted to start today by talking a little bit about some takeaways from our last session, which reviewed ways to talk to your children about the pandemic. And so just keeping in mind that it's really important to continue to talk to your children about the COVID-19 pandemic. Kids are going to have lots of questions about what's going on and how they're going to be kept safe. So make sure that you encourage them to ask their questions and talk to them about their concerns. And remember that it's okay to say that you're not sure of an answer. There's so many things about the virus and what's happening that we don't know, and we're still learning. So it's important to model that uncertainty for our children and let them know that it's okay and that you are there to help them and keep them safe. You want to focus again on safety, making sure that you're explaining the precautions that we're all taking and why we're taking those precautions. Reminding them to wash their hands, wear a face mask or a face covering when they're with others, and doing whatever they can do to help stop spread the COVID-19 virus. And also making sure that we're staying calm, having conversations with them at a time where everybody's calm and there's no extra distractions. It's going to be very important. Also, you want to make sure you understand that the symptoms of COVID-19, and really understanding that they can also overlap with other mental health concerns or other different conditions, such as the flu. So making sure that you're aware of what the symptoms are, but seeking medical help when in doubt. Um, Finally, also watch out for some warning signs that your child is having difficulty, such as increased anxiety, increased depression, any emotional outbursts like temper tantrums, difficulties concentrating, overall difficulties regulating emotions, and acting out behaviors. You also want to watch out for any suicidal thoughts or behaviors, especially as we're staying home a little bit more. We might feel a little bit more isolated, so making sure if there's isolation from the family, they're staying in their room a lot more than typical. Any changes in sleeping or eating habits, mood changes, behavior changes, increased in substance use, talking about wanting to die, writing or drawing about potential suicide, talking about feeling hopeless or helpless or being a burden. So we want to make sure that we're monitoring our children's behavior, and if you're feeling like your child might be feeling suicidal, make sure you come out and ask them, because some children may be more forthcoming with this information than others. You also want to watch out for any behavioral changes, especially unhealthy behavioral changes and any behaviors that might have been typical of a child younger than your child's chronological age, such as sucking their thumb, wetting the bed, things like that. Those are all signs that your child might be having some difficulties. We want to make sure that we're supporting your children, sticking to routines. These are definitely key. Children need predictability. They need to know what's going to happen, and they want to know that know what to expect each day. So if you can, make sure that you have things like family activities, games, exercising, safe activities outside of the home planned into your day so that they know what's coming. We want to make sure that we stay away from too much news. Too much can definitely feed anxiety. So make sure that you stay current, get some facts, but at some point you want to turn off the news and spend time together as a family. Make sure your children and yourselves are socializing, whether that be virtually or social distance, outside activities. Staying connected is definitely good for our moods. So we want to make sure to encourage that with our children, and make sure you're checking in with your children periodically so they can identify and discuss any concerns that they're having with you. And finally, it's really important for you as caregivers to take care of yourself. Oftentimes, we overlook this as caretakers, so make sure that you're paying attention to your own needs, your physical, emotional, and social needs, and seek help when support when needed. So today we're going to talk about the different ways to talk to young children and older children about the pandemic. We'll talk about some activities that you can do with your children, how to incorporate really important academic skills during your time at home, and some coping strategies for children to use when they're feeling overwhelmed. So first, we want to talk about talking to young children about this pandemic and really focusing on children, 5 and under. It's important to provide just simple information, reminding them that adults are there to help them and to support them. We want to stick to some facts and provide reassurance that, there is there's things that they can do to stay healthy, and we really want to avoid any extra anxiety. It's important to talk about masks. We want to explain simply that people wear masks when they're feeling sick or to keep them from getting sick or to keep other people from getting sick. We want to avoid too much detail about germs specifically, because that might make them a little bit more anxious when they're going out of the home. Um, and we also don't want to have too much information that is difficult for them to understand. So it's important to reassure them that if they're in the presence of somebody wearing a mask, or if they're asked to wear a mask themselves, there's no danger about that person or themselves, that we're just wearing masks to help others and to play a role in stopping the spread of coronavirus, and make sure that they know that the parents are there to help them or doctors are there to help them if needed. We want to make sure that we're emphasizing safety. We want to practice hand washing, practice wearing masks. You could have them, pretend to wear masks and teach them how to put it on, take it off, and make sure that they're aware of the steps that they need to take, while remaining calm and making sure that we're not talking to them about the virus or the masks when we're all feeling anxious. Some things that you might see here behaviorally with young children: you want to remember that you can help children by maintaining routines, limiting exposure to media regarding COVID-19, avoid discussing your own concerns with them, and practicing good hygiene at home. Remember to remind them that you are there to help them and to support them if they have questions, and explain simply why things are different now. Young children may not have developed the ability to talk about some of their feelings, or they might not have that toolbox of coping skills that oftentimes adults have. So you make sure that you have some quiet time with your child together, engage in positive activities with them, and help them practice things like breathing or drawing what they're feeling, to help them cope with their emotions during this time. And in terms of activities, it's really important to have a variety of planned activities within your daily schedule to keep your young child engaged actively. One suggestion might be to have some toy rotations where you pick out just a few toys, and kind of put the rest of them away. And that way you can switch them out, every week or every few days, to help, avoid boredom with the activities that you have at home. Signs of boredom might be, whining, difficulties focusing, moving from one activity to another, becoming aggressive, things like that. So switching out will help to reduce the boredom, at least for some of the time. Outside time is going to be really important, as much as you can during the hot weather. Take some time to go outside, make up games that may not involve any playground equipment or other equipment that others have to touch, but make sure you're moving around. You can do activities like moving like certain animals, playing I Spy as you're walking around your neighborhood, collecting items like rocks and leaves, and using sidewalk chalk or bubbles to help them stay active. That physical play is definitely going to be important. You can do this outside during, with the activities we just discussed, or you can do, inside dance parties, putting cushions or toys on the floor, and creating obstacle courses, bed sheet parachute play, just to help them, get engaged with you. But on the other side, you also want to have some quiet playtime. So things like reading, coloring, doing a puzzle, doing blocks or sorting objects is important. So they get, a wide variety of activities. Make sure you do some emotional check-ins to attend to any social emotional development concerns, talk about how they're feeling, talk about the day and what they thought about the activities during the day, what they think might happen tomorrow, and just use any opportunities to have conversations with your children. And finally, it's important to help them continue to develop any motor skills. So practicing fine motor skills like sorting, coloring, and using small tools to, gross motor skills. So that jumping, catching, dribbling ball, running, all of those things that keep them active. Most research suggests that it's important to limit screen time, especially for children under age 2. However, with everything that's going on and we're having children be less socialized in person, video chats are going to be really important for young children to maintain some of those social skills. So you want to try to plan ahead, especially for kids. You want to plan a good time of the day. Try to avoid when your child might be hungry or they might be tired. You don't want to do it around nap times or meal times. And we want to promote that social interaction. So some activities that you could do while you're on a video chat would be those that might focus on the senses. So talk about, some of the things that they see, some of the things that they hear on the screen, talking about, what things might feel like or smell like, really focusing on the senses. And during these video chats, you want to make sure that you have materials available. So the person on the other end can read them a book, or they can color a picture together. Little things that you can do to keep your child engaged during that screen time. For adults, while video chatting with a young child, you want to make sure that you're looking directly at the camera and not looking at your own picture, because it's really important to mimic that social interaction that you would get in person, including that positive eye contact as much as possible. So, other things that you can do as an adult video chatting with a young child, playing games like peekaboo, singing a song, doing a dance together, also using consistent greetings and consistent tone of voice so that they're able to recognize you as somebody that they've seen before, and help them become a little bit more comfortable speaking with you on the video chat. And finally, using gestures, because gestures definitely make conversations more interactive, and they also mimic face-to-face social interactions as well. For school-age children, it's important to remember that children at this age are really more likely to ask questions, and we want to answer those questions and try to be as truthful as possible. It's important to, again, acknowledge we're still learning about the virus. There might be some things we don't know, but letting them know that you're there to support them. We want to address rumors as quickly as possible and focus on reality. So again, sticking to the facts as you know them, and trying to dispel any rumors that your children are talking about. And then again, reminding them of the steps that are taken to avoid spreading the virus, like hand washing, wearing masks, staying 6 feet of distance, and involve them in the planning process of how you're going to keep your family safe. In terms of incorporating academic skills, it's important to keep your kids engaged in learning even when they're at home, to help prevent learning loss. So, there's some fun everyday activities that you can do that you're already doing at home that can incorporate some of these academic skills. So we'll start with math, and if you think about it, we all have to do meal prep. So you can get your kids involved in this, and having them do things like counting out the number of utensils and plates that are needed, measuring out some ingredients, predicting how much of something that you might need, comparing shapes of fruits and vegetables, determining who has less and who has more. So there's a whole lot of things that you can do to really get at those math concepts. Same thing with gardening, getting outside, doing some gardening. You can help them, have them help you measure out, how much water do you need to water the plants? How many seeds might you use? You can predict how many days it will take something to grow and then tally the days to keep track of that. Um, so, being creative and things that they also might enjoy learning about as well. In terms of reading, you can schedule like a daily book reading time where your child gets to pick what book that they want to read, and they can do it with you or by themselves. But you might be able to identify some vocabulary words throughout um, the book that your child is reading, and then you use them throughout the day. You can create a language restaurant. So, within your home, having, takeout menus, and other things like food containers, and they can interact with those and practice reading the words on the menus and containers. And then also having a writing center. So at home, if you have an area that they can use as a desk, paper, writing utensils, things like that that they can use to be creative, writing letters out to family and friends, and then you can send them as a great way to keep them, engaged, and creating stories and art projects, something that gets their mind going and provides them some enjoyable activities. And finally, looking up different museums. Some of them have been offering virtual tours since people aren't able to travel as much. So, that gives them some fun learning activities as well that they can do from home. Screen time can be quite a challenge, even when there's no pandemic. Parents find it pretty difficult as it is to balance screen time with other activities. However, with the increase in distance learning and a decrease in available activities to do outside of the home, we're going to want to create more of a balance, and some boundaries around some screen time. But it's important, when you're setting boundaries, that you're flexible within reason. So often for kids around this age and even older, screens are a sense of comfort and entertainment, but too much can definitely become a problem, especially if they're not engaging in any other activities like exercising and proper social interaction. So you can use extra screen time as a bonus for good behavior or an incentive for completing tasks at home as well. And when you're not allowing your child to use screens, make sure that you have a menu of alternative activities that they can engage in to reduce some of that boredom and any acting out behaviors. You want to make sure that you're keeping a schedule of when screens will be allowed and try to stick to that as much as possible. So that way, children again know what to expect, and trying to avoid any of those behavior escalations by not having consistent rules. And then lead by example. So, it's easy for, caregivers to also get involved with, social media and other things that we're doing on our phones. So, make sure you put your own boundaries on your own screen time use. We want to make sure that we're encouraging wellness. So make sure you're focusing on, proper eating, proper hygiene, proper sleeping, exercise, some family time and socializing, as well as some learning time. So make sure that you're really providing balanced activities that encourages wellness as well. And again, that social connection piece is really important. So make sure you're connecting with family, you're having creative activities that your children can do with friends online, and make sure they're really utilizing social distancing and any other screens to make those social connections. And finally, make sure you check in and make connections yourself with your child. So, while your children are engaged in some of the games that they enjoy, take some time to maybe become involved with that. Ask them what they're playing. Ask if they can play, if you can play with you. Maybe start a game together. This will allow you to monitor their activity, but also connect with your child as well. And it shows that you're interested in what they're doing and what they're interested in. So you can, introduce new games or new activities that they can do on their screens if they're doing the same thing over and over again. And again, really creating some positive time together. When it comes to teens, it's really important to maintain communication and be as open and honest as you can. You want to make sure that you give them space to share their thoughts and concerns and also their frustrations. There's a lot of things that teens are missing out upon when they're not able to see their friends and they're not able to go to school the way they were. Even last year. So, acknowledging those frustrations and making sure that you're checking in with them. It's also important to share reputable sources. A lot of times, teens get their information from social media or other friends, and it may not be as accurate as we want it to be. So make sure that you're discussing with them what a reputable source would be. Things like the CDC, the National Institute of Health. Our news, NPR, making sure that they're not getting all of their information from social media, and also discussing social distancing and making sure they understand what it means and why it's so important, and remind them that so many things are different right now and there are so many different opinions that go along with the precautions. It's difficult to know who is following the precautions as your family is. So just making them aware of that, and modeling some respect for differences of opinions as well. So again, we want to pay attention to potential warning signs that your child is having difficulty coping with changes. Make sure you're paying attention to any acting out, any irritation, crying, changes in behavior, difficulties paying attention, difficulties with excessive worry or sadness, any complaints of any pains like headaches or stomach aches. Changes in school performance, and then again, those suicidal thoughts or behaviors. Make sure you're checking in with your child and getting help as soon as you notice that they might be having some difficulty. When it comes to keeping kids safe, you want to make sure that you're listening to your teens and what their worries are. So, remembering that children's worries are very different from our own as adults, and try to be as patient and understanding as possible and hear them out. Their world is often centered around, their social circle and their friends, and their worries will likely be around, social interactions as well. So make sure you're checking in with them and allowing them to talk to you about their worries, and they could be about how they're looking in a mask, how they're going to wear a mask to school, what if their friends aren't wearing masks, things like that. So help them problem solve things around that. Make sure that you have clear rules, and make sure they're reasonable for them to follow, and take their feelings into account as much as possible. It can be helpful to link independence with safety. So, talking to them about the more precautions that you're taking and the more you follow our family rules, the more that you as a parent will feel safe in letting them, venture out and do some more things in the community and with their friends. It's important to work together to come up with ways that they can maintain their safety, when they do start going out with friends or, socializing a little bit more. So talking about that 6 feet of distance, you might want to measure that 6 feet and practice staying apart so they can see what that actually looks like. Talk about a list of outdoor activities that they can do around the community. You can make or buy masks that kind of fit their personality and things that they enjoy, so that they might be more likely to wear them. You know, also empathizing and validating with what they're going through. So we are all feeling the toll that this virus is taking, and let your kids know that you're feeling it, and you understand that they're feeling it as well. And hopefully that validation will allow your child to feel able to be more open with you and have conversations. um, we may need to help our teens with perspective taking. Teens and all kids might be thinking, this is going to last forever, but remind them, there's lots of people working on, finding, a solution to COVID and a vaccine. That this is not actually going to last forever, and the restrictions that are being put on them are temporary. But you want to remind them that they've gotten through some tough times in the past. talk about those tough times and how they got past them, and that you have confidence that they'll be able to do that again. As mentioned before, we want to make sure that we're sticking to facts only. We want to avoid, talking about worst case scenarios or hypothetical situations just to get our point across. We just want to make sure that we're sticking to what's important, sticking to what the science is saying, and reminding them of the role that they have in um, slowing the spread of COVID. Again, using trusted sources, so making sure they're not just getting their information from social media, and giving them resources like the CDC, the World Health Organization, NPR, National Institute of Health, and even calling their physician to have a conversation with their physician about some of the things that they've learned, and some of the things that they can do. And then help them make it personal. So, it might be that they don't feel that the virus is really impacting them personally. So, relate it to any family members or friends that might be more at risk, especially like grandparents or immunocompromised individuals. So, to help them relate to, you're keeping this person safe, not just this general, you know, thought of just keeping everybody safe. You're relating it to somebody that they know, and also showing them the graphs and the numbers of how the spread of the infection can be slowed, and it will allow them to see how their behaviors can actually have an impact on the days and weeks to come. Lots of children at this time with ADHD might be having some difficulties with all the changes in learning activities, and just being at home, and inside in general. So it's definitely important to remember that there might be some special accommodations you might need to make for any child that you have that has attention deficit hyperactivity disorder. First and foremost, making sure that you're maintaining a consistent schedule. We know that children with ADHD benefit from structure and scheduling, and this will help them stay organized, as well as make a transition to school and to other activities less difficult. You don't have to have, really strict schedules, but it should consist of having a consistent bedtime and wake up time, meal times, and then, kind of expected activities throughout the day. You want to make sure that you're setting goals for your child, make sure they're achievable, and ways that they can stay motivated, and give them a positive sense of accomplishment. So it could be something like learning a new skill, like a cooking skill or baking, playing an instrument, gardening outside, learning to ride a bike without training wheels, learning to swim, things like that. So anything that they might enjoy, but gives them that positive sense of accomplishment. And then prepare them for new activities and new rules. So if anything's changing, if anything's going to happen that's different, make sure that you talk to them about it ahead of time and help with that transition, and talk about what's going to be expected during any of those changes. It's always important for most kids to provide reminders of when time is up, when we're going to be transitioning to a new activity, or when something has changed. But it's especially important for children with ADHD to have some reminders of the expectations and the rules. And then finally, provide breaks. So, break time should be times where children can engage in some preferred activities, and this is really a good thing for all kids, but especially with children with ADHD, making sure that they get some time away from the structured activities and get some of their energy out for sure, and help them choose activities that promote feelings of competency and relaxation during these break times. Children, as many of us are likely eager to get out and do things that they were doing prior to COVID-19, especially with their friends. So, you need to make sure that you're balancing your own comfort level as a family with what your child needs, and really compromise only when you feel it's safe to do so. It's important to respect the choices of others, but don't feel like you have to change your own decisions. But at the same time, you know what's best for your child and your family, and it sometimes might be difficult for your child to understand that, especially if their friends are maybe relaxing their precautions a little bit more. So do your best to explain the precautions that you're taking as a family and why you're choosing to do them to the level that you are, and make sure this is done in a developmentally appropriate way, but also, acknowledging that other families might be different, and they're doing what is best for their family at the time and modeling respect of that. And also, you want to reach out to like-minded friends, family friends. So allow your children to interact with other families that are engaging in some of the same behaviors that you are. So that way you'll feel a little bit more comfortable expanding your social circle to those outside of the family. There's definitely many opportunities for challenges as we start reopening and going back to somewhat more normal activities. So you want to prepare ahead of time for those challenges, and those can look like, your child's friends are not taking precautions. Maybe they're being teased for taking precautions, or there's peer pressure to not wear a mask when they go out, and talking to your child, about the virus not being such a big deal. Um, there's lots of differences of opinion when it comes to COVID-19. So it's important to validate and recognize that it's really hard to navigate some of these challenges and stick to the plan that your family has laid out. And at the same time, you want to make sure that your children understand, again, why you're taking the precautions. You want to practice addressing the challenges. So, talking to your child about what would you do if you were encountered with a friend that wasn't wearing a mask. Help them identify ways that they can stick to that family rule and those family values, and communicate to their friends if needed why they're taking the precautions that they are. You can offer yourself up as an excuse. So if there's challenges with friends, you can say, well, I can't do that because, my mom won't let me or my dad won't let me, um, you know, to allow some of that pressure to be taken off. And definitely talking about these things ahead of time will help make it easier for them to address issues as it comes up. Um, and finally, we want to address lying when it comes to preparing for these challenges. Children lie for many reasons, but at this time, it's extremely important that they are honest and open with you about their behaviors, even when they make a mistake or break one of the rules. The health and safety of family and friends can depend on it. So we want to encourage them to come clean as soon as possible. If they have, broken a rule, maybe give them, a get out of jail free card, so to speak. So if they tell you the truth, then, you'll let it slide, or, have a lesser punishment than, typical, because they're being honest with you. And talk to them about this before, sending them off to be with their friends, so that they know, if I make a mistake, if I tell mom, or dad, I may not get as strict punishment. And then again, reminding them about the potential consequences of their actions, whether it be to a family member or a friend. And with increased time at home, there, is definitely a set of challenges that come around with having siblings at home together. We find that children of different ages get different privileges at different times, and when everyone at home more, it's more easy to see the differences between kids, especially of different ages, and the other children in the home will definitely let you know about their observations. So we want to make sure that we're aware of this and prepared, because arguments in close quarters are more likely to happen. So make sure that you're setting ground rules when everyone's calm. Talk about the rules that you as a family are setting, and problem solve any issues that might come about before they happen. Again, creating schedules is going to be really important, especially for the use of electronics and other toys that may be commonly fought over or are required to share. And while one sibling's using one of those, those toys, make sure there might be a schedule for alternative activities for other activities that they can be doing. Want to be specific about the rules and how you're enforcing them. For younger children, it might be helpful to use timers to help with turn taking, having a visual schedule so that each child knows what's happening next. For older children, you might have a written contract where everyone's working together and developing a plan and signing that plan. And then for teens, you might have a more conversational approach and asking for their input on what they think the rules should be. Um, we want to make sure that we're providing positive reinforcement for kids, especially when we see those behaviors that we want, those, proactive behaviors, the, positive interactions. We want to ignore what we can ignore, and recognize them for the positive behaviors that they're doing. It is important to remember not to ignore any aggressive behaviors or destructive behaviors. Um, because that is often a sign that a child is overwhelmed or having difficulty coping. So we want to address that a little bit differently. We want to be as open and honest with our children about the differences between siblings, especially if we have older children in the home, discussing why one may have more responsibility than the other, why one might get more time on the screen than the other, and communicate why there might be different rules, and model that adapting to differences. We want to set responsibilities as well. Each child in your home should have a set of their own responsibilities, and those roles should be defined for every member of the family. Older kids need to know, especially what you need from them in terms of, if there's need for childcare or extra chores to do at home. So making sure that they're aware of it, expectations for when you're home versus when you're not home in terms of babysitting, and putting age appropriate boundaries down. If you're relying on an older child for help, um, discuss what their limits to responsibility will be. For example, you're not the boss when mom and dad are home, or what they need to do to get in touch with you if there's a problem, and when they should come to you for help versus when they can try to handle a problem on their own. And again, we want to focus on the positives. So try to find ways that you can positively encourage relationship building with your kids or in between your kids. Talk about, how their relationship has improved over the past few months, praising the positive behaviors when they're, playing a game together, doing something, um, you know, cooperatively. Encourage shared experiences. So, have them play a game together, or do a puzzle, have a family movie night, go for walks, things that they're doing together and sharing those positive experiences. And finally, rewarding teamwork. So, if they have shared interests or shared chores, reward those positive interactions and completion of that activity, especially if they're done without argument. And finally, we also want to encourage the use of coping skills. So first here, you'll see some mindfulness activities. Mindfulness is really important and can be incorporated through everyday activities. So just, a reminder, mindfulness is intentionally focusing on something in the present moment, where you are, where your thoughts, where your feelings are, without trying to make any changes, just acknowledging, things as they are. So things that you can do to encourage some mindfulness, you can start by paying attention to your body, squeezing different muscles within your body, and counting to 5 to release them, and noticing how your muscles and your body feel, and how those feelings change throughout the day. Belly breathing also, putting one hand on your stomach and one hand on your chest and slowly breathing from your stomach in and out. There's lots of resources on how to do belly breathing on the internet. So I'd encourage you to look up some of those relaxation um, videos to help you learn with that. As a family, you can do things like having a mindful meal where, while you're eating, you're paying attention to, how does the food look? How does it smell? How does it feel? How does it taste? And, talking to each other about your experiences with your meal. Things like blowing bubbles can help, with that practicing of breathing, coloring, listening to music, things that we tend to find relaxing, choosing something that is enjoyable to you and your family. Again, the point is to practice and let things be as they are without trying to change anything, and learn to accept what we're doing. And it's important during this time not to be multitasking and really just focusing on some relaxation time. You can also make sure that you're engaging in positive activities as a coping skill. This can be different for any child. So, making sure you're having a conversation and talking to them about what they would like to do, as long as it's an acceptable activity. This could be playing a game, it could be coloring, it could be reading, riding a bike, anything that is, a positive break from, our news and, school and things like that. And talking to family and friends, making sure that you're scheduling time to maintain those social connections, and seeking professional help when needed if you notice any of the warning signs that we discussed previously. So, as a reminder, we want to make sure that we're coping with COVID-19. We're taking breaks from the news. We're taking some time for ourselves and being able to unwind. We're setting, realistic goals and priorities, and giving ourselves that sense of accomplishment. We're taking care of our bodies. We're connecting with others, and especially we're focusing on the facts, and trying to avoid any myths or rumors associated with COVID-19. And please remember that we here at Meridian, we're open. We are here to help. So we provide individual and group therapy. You can be seen in our offices over telehealth, and we also have crisis response resources as well. So please, please, please reach out to us if you are in need of additional services. And just for some information, in Alachua County, we have our resource centers that you can reach out to for support. The United Way of North Central Florida, our Early Learning Coalition, our public schools have great resources as well, and we have the National Alliance on Mental Illness here in Gainesville as well for some more resources. In our Tri-County area, you can contact the Tri-County Community Resource Center, the Early Learning Coalition, and the library systems as well to get additional resources. In our northern counties, reach out to the United Way, the Northeast Florida Community Action Agency, the Early Learning Coalition, and Florida Diagnostic and Learning System. And additionally, we have our national mental health resources, such as the National Alliance on Mental Illness, the Centers for Disease Control, the National Institute of Mental Health, and also our National Suicide Prevention Lifeline. If you or someone you know is contemplating suicide, they can reach out to 1-800-273-TALK to talk to somebody, and get some resources for any suicidal ideation. And the next time we meet, we will be talking about preparing to go back to school, to dealing with differences between virtual learning and in-person learning, ways that children and families can stay safe, how we can cope with those changes, and how we can address stigma of any kind as we return to school and encounter differences of opinion. And remember, if you have any more specific questions, please send them in for our September 2nd webinar. You can email Denise Thomas at the email below, or bring your questions to our September 2nd meeting. All right, and that is all we have today. I appreciate everyone viewing and joining us. Please reach out to us if you have any questions. And again, if you need any additional sources, please reach out to Meridian. Have a great day, everyone.